Stephanie. I'm going to be your nurse practitioner today. What brings you to see me?
Hi, Stephanie. I'm coming to get a full physical.
Okay. And what's your name, please?
My name is Monir Sharafi, but I go by Mo.
Well, hi, Mo. And when's your birthday, please?
April 14th, 1987.
Okay. Now, you're having this physical for what? School or
sports?
School. Okay. What school are you going to?
I'm going to Winston-Salem State University. Go Rams.
All right.
And I'm going in the Family Nurse Practitioner program.
Well, I went to that program too, and you're going to love it. It's
Really?
an absolutely great program. Yes,
Awesome.
It is. All right. I want you to tell me a few things about yourself. First of all, have you had a fever lately? Have you noticed any changes in temperatures? I'm just going to be taking a look at your body and inspecting things as we talk.
Okay.
Okay, trying to do a couple things at once. Noticed any swelling in your hands or your fingers or your joints? Any? Nothing?
No swelling, no fever,
Okay.
no warm.
Any pain, tenderness, you said no swelling or edema in your feet or anything like that?
No, ma'am.
Okay. Do you have any problems with headaches or have you noticed any soreness in your hair? I'm just going to feel around if that's okay with you.
Yeah, that's fine.
And no nodules, nothing when you wash your hair, it doesn't feel like there's a burning sensation, no itching, anything like this?
No, ma'am.
Okay. And your hair, you have very curly hair, a lot of it. Well, but that's lots of fun to try to keep under a hat, huh?
Yeah, it's hard.
All right, I'm going to also be feeling your frontal sinuses here. Do you have any allergies?
Yes, I do. As you can tell by my large nose.
Yeah. And also tell that your eye under your eyes is a little dark too. And your nose, has it been broken before?
No, I just have a horrible deviated septum.
Okay, yeah. All right. Also, back here you have the nodes, and this is your occipital nodes back here, your post-auricular, your pre-auricular, tonsils, your submandibular, submental. Anything here? And you notice any changes?
No, ma'am.
Okay, if I could get you to turn your head just a little to the left, I'm going to look at your posterior and your anterior cervical chains down here around your subclaviculars. Okay, turn to the other side for me, please. We'll do the same thing over here. And there's no tenderness over here, nothing that you noticed before. Okay, great. All right. Can you do me a favor?
Sure.
We'll be looking at your eyes, please. The first thing I want to do is just do a quick little test. I'm going to ask you to cover up your right eye for me, and then hold this card, and then we're going to see what your vision is, please. Would you read the lowest number or the lowest line for me?
DEFPOTEC.
Wow, fantastic. Okay, if you could change eyes for me, please, and do this again.
All right, DEFPOTEC.
Okay, you have 20/20 bilateral. That is good.
Right.
All right, I'm going to ask you to follow my finger.
Okay.
Okay. Keep your head still. And we're going to test for cranial nerves 2, 3, 4, and 6. Okay. We're just going to test the movement of your eyes, please.
Okay.
All right. Fantastic. Good. Keep your head still for me. Great. Okay. Now, I would like for you to cover up your left eye for me, please. And I'm going to cover up my right eye. And what we're going to do is we're going to look for your perception, your peripheral vision. Okay. So let me know when you see my fingers.
I see him. I see him. I see him.
Okay, and let's do the other side too, please. You ready? Okay.
I see them. I see them. I see them.
Okay, good. The next thing I want to do is take a look at your eyes. Okay. First, will you take a spot behind me, please, and take a look at it.
Okay.
And then take a look at my pen for me, please. Look back at me, and now look back at the spot again. Good, thank you. I was just checking to see if your pupils were going to dilate and constrict when you changed positions of your eyes. I'm just going to take a quick look there. Good. Just checking to see, make sure that your pupils react to light equally. Fantastic. Next thing I'm going to do is I'm going to take a look at your eyes some more. This is the entire time we're going to be looking at your eyes. I'm going to be looking for your red reflex, your corneal reflexes, which we just did. Then I'm also going to be looking inside your eye. I'm going to be taking a look at your arteries, your fundus, and your optic disc. Okay. Okay. this for me, please? And I'm going to look where it reflects. Good. Excellent. Okay, I'm going to take a look in your eye. You just look straight ahead for me. I'm going to look at your nerve, the vessels in your eye, your arteries specifically. I see your fundus and your optic disc. Very good. We'll take a look over here too, please. Okay, that's really good. The vessels are very nice and healthy. Good. The next thing I'm going to do is take a look in your ears. Okay. Have you been having any problems with drainage or noticed any hearing loss, any ringing in your ears or anything along those lines?
No, I do have some hair on my ears,
Mm-hmm.
but I don't know if that's normal or not.
No, there's a little bit, and you'll also notice as you age, particularly with men, that they will get even more hair around their ears.
Yeah.
Okay.
All right.
So that'll be a little bit normal. So take a look in your ear. I'm going to be looking specifically to make sure that there's no wax buildup in your ear, and that I don't see any redness or swelling of your tympanic membranes. Everything looks nice. You have a good reflex on your light. Was that hurting you?
No,
Okay.
not at all.
All right. Okay, and that one looks good too.
All right.
Okay. Next thing I'm going to ask you to do is look up for me. I am going to look in your nose. Okay, your terminates are red. And yes, you do have a deviated septum, don't you?
Yeah, it's horrible.
Wow. Yeah. Okay. Do you notice any problems at night when you sleep? Does it cause you to snore a lot? Have you ever been considered for a sleep study? Anything along those lines?
I don't think I snore.
Okay. Well, has anyone told you that you snore? Like when you lived at home with your parents, didn't your mom or anybody tell you?
No, I don't
know.
I don't think so.
Okay. All right. Well, I'm gonna look in your mouth, please. I'm gonna ask you to open your hand. Thank you. And say ah. Fantastic. Okay. I'm just gonna look. Raise your tongue. Thank you. Look inside. And very nice teeth. Excellent. Okay. Check your gag. You ready? Okay, good.
Whoa. I wasn't expecting that.
I apologize. Can you do me a favor and smile for me? Okay, there you go. Now stick out your tongue. All right, and if you could take your tongue from side to side. Excellent. All right, grit your teeth heavy. Excellent. Now look, raise your eyebrows up and down. Good. I'm also going to feel here, this is your TMJ, and if I could ask you to open and close for me. Okay, do you feel any clicking? Does that hurt? Does it bother you when you chew? Okay, you can stop. You do have a little bit of deviation there.
Yeah.
Does it bother you a lot? Did you ever had an accident where your jaw was dislocated or
I don't know.
box?
I've had 4 concussions.
What sport did you play?
I played soccer and football, and I snowboard.
Oh, excellent. Do you wear a helmet when you snowboard?
Absolutely not.
Okay, you might want to consider that.
Okay.
The increased risk for permanent brain damage is also increased with the number of concussions that you have.
All right.
And so you also have a risk for short-term memory loss, long-term memory loss, and so those things are very important for you to keep in mind and options that you need to think about.
If I remember that, I'll wear a helmet next time.
I will write it down for you. Okay, so that way you'll have it on a sticky.
All right.
Okay. Now, I know that you have some issues with your nose, but do you have any trouble breathing? Can you usually have senseless smell and everything?
Yes,
okay, could I ask you to close your eyes, please, and take your nose and finger and put one side and close it. And then I'm going to ask you to tell me what this is.
That smells like vanilla extract.
Excellent. Okay, now we're going to go on the other side, and I'm going to try something else for me, please. If you could do the other side for me. And what does this smell like?
Smells like alcohol, rubbing alcohol.
Okay, great. I'm going to come up behind you. We're going to test your hearing. Okay. And I'm going to whisper into your ear, and if you would put your finger in your left ear while I whisper in your right one.
Okay.
Repeat this for me, please.
Cat, dog, house.
Okay, if you can put your finger in your right ear, I'm going to repeat for you.
147.
Okay, the next thing I'm going to do is I'm going to use a tuning fork and I'm going to put it on top of your head, and I want you to tell me if you hear the sound in both of your ears at the same time.
Yes, I do.
Okay, I'm going to come back around, and the next thing I'm going to do is we're going to do it on each side. We're going to test bone conduction versus air conduction. Okay, so first we're going to do the bone and then the air each side. Okay, so this is for the bone. Tell me when you stop hearing it.
Okay.
And tell me when you stop hearing it.
All right.
Okay, we're going to do it on this side too. Okay. Tell me when you stop hearing it.
All right.
And tell me when you stop hearing it.
Okay.
Excellent. Air conduction should be twice as long as bone conduction, and you are very good limits. Thank you very much. The next thing I'm going to ask you to do is I do want to take a look at your eyes and your eyelashes. Do you have any drainage, any problems in the mornings when you wake up?
No, ma'am.
Okay, your eyes sore. You
No,
said you're
ma'am.
in school. Do you have any trouble with them being tired at night after you finish with your...
Absolutely.
Absolutely. I remember those days very, very, very well. Alrighty. Next thing I'm going to do is we're going to move on to your range of motion.
Okay.
Okay, and your neck. I'm going to test your neck, and if you could do me a favor and turn your head towards your shoulder on your left. Okay, and then to your right. Alright, and then take your head and tilt it to the left and to the right and forwards and backwards. Okay. Does it cause any trouble? Take and rotate your neck for me, please. Any pain?
No, ma'am.
Okay. And I'm going to ask you to push against my hand. Excellent. And again. All right. And then turn into my hand. Again. And if I could ask you to shrug your shoulders for me, please. Okay, good. Any of those, any problems? Those were the shrugs we're testing for your cranial nerve 11, making sure that your spinal accessory muscles were good and intact. I'm going to take a few minutes to work on your back really quick. I'm going to percuss and just make sure that you're not having any trouble with your lungs. Okay, that'll be the next thing that we work on. I've noticed that you have nice percussion. Can I ask you to take a deep breath in for me, please? Excellent. Okay. I don't see any moles. I don't see any lesions or anything. All right. So I'm going to just take a listen out here. I'm going to be percussing for resonance. Okay, excellent. Next thing I'm going to ask you to do, I'm just going to feel your spines. Make sure I feel all of them. There's no tenderness, no joint, anything that wrong back here. Anything here?
No, ma'am.
Okay. Excellent. All right. Can you please say the words 99 for me?
99.
Again.
99.
And one more time.
99.
Okay. Fantastic. I'm going to take a listen while I'm back here. Okay, just breathe normally for me, please. Okay. Get a pencil real quick. I want to check something else with you. Okay. Next thing I'm going to ask you to do is just Take a deep breath in for me and hold it, and then I'm going to be tapping. You ready? Okay, relax, and take another one in for me, please. Okay, there you go. Now blow out as hard as you can, and then hold it. Great. Okay, relax, and then do it again for me, please. Excellent. Okay, now let me put my pen about very good. Almost 4 centimeters on each side. All right. Okay, now just breathe normally. You haven't felt any little thrills or any pulsations, any palpitations, anything like that?
No, ma'am.
Okay. All right, the next thing I'm going to do is I'm going to listen, I'm going to feel for your carotid artery. We'll feel for your brachial. Just relax. Relax your hands right here. Fantastic. Work out daily?
No, I like to play video games.
Oh, okay.
This is just natural.
Wow, you must have very good genes.
Yeah.
Okay. Fantastic. I'm going to take a listen to your lungs up front, and then I'm going to take a listen to your heart, okay?
All right.
Listen to your carotid arteries first. I'm going to use my bell. Listen for any bruise. Take a deep breath for me, please. And again. Okay. All right. So can you take a deep breath, please? Make sure your lungs. Okay, raise your arm up for me, please. And breathe one more time. Excellent. Okay. All right. Next thing I'm going to do is listen to your heart, okay? Let's see. Listen for your aortic valve here, your pulmonary valve here, your tricuspid, and then your mitral. Also going to listen to your carotid. Feel free to listen. Thank you. All right. The next thing I'm going to do is take a look at your abdomen. So if I could ask you to lay down for me, please.
All right. I'm kind of tall, so I'm just gonna put my
Yeah, I've
legs up
got
here.
this staying right here. For some reason, if it feels better for you to lay down a little bit further, let me know.
Okay.
Okay. First thing, I see that you don't have, you lay your head down. Yeah, raise your head up for me, please. I want to see, do you have any pain, anything, any places here on your abdomen that bother you?
No, ma'am.
Okay, then I'm going to ask you just to lean up just a little bit for me, and then just look back. Nudge up here. Just a smidgen right here. Okay, bring back down for me, please. And all the way down. Alrighty. Thank you. Okay. We'll take a listen. Listen for your bowel sounds. Use the bell, my stethoscope, to listen for any rubs of your liver, or your spleen. I will listen to your aortic, your renals, and your iliacs. Your lumbricus. You're gonna feel me touching you. It's gonna be light touch. Is there any tenderness anywhere? You have any problems?
No, ma'am.
You have any change in bowel habits?
No.
Any problems with urination? Anything like that?
No, ma'am.
This is going to be a little deeper. Does any of this bother you at all?
No, ma'am.
Okay. Okay. I'm going to feel here. And you take a deep breath in for me, please. Okay. Feel clear. Okay, relax. All right. I'm just feeling for your aorta. I'm going to see about feeling for your kidneys. So if you take a deep breath in for me, please. Okay. And let it go. Alright. And if you could do that again for me, please. Deep breath in and then relax. Alright. The next thing I'm going to do is see about find your liver. Just relax. Any of that hurt?
Nope.
Okay. And how about over here with your spleen? Any of that bothering you? I don't feel.
No.
Okay. Next thing I'm going to do is I'm going to cuss for your liver, okay? So, first, after I percuss in your quadrants, tympani throughout. Is that ticklish? Does that hurt you a little bit?
It's a little ticklish.
I'm sorry. Okay.
But your hands are warm.
Oh, good. Usually I don't have many people tell me I have warm hands, so I've been trying very hard to rub them together before I touch my patients so they don't get freezing cold. Okay. Bear with me just a minute. Okay. Alright. Okay. Alrighty. This is going to be it's about 8 centimeters. Fantastic.
All right.
Okay. Now, if you'll just hold still just a second, and let me know. Okay, I'm going to test for your reflexes. Okay. Alright. Okay. Now, you said you've had no trouble with your umbilicus, nothing like that.
Correct.
You haven't had any hernia pressure. And I've already had you take a deep breath so I can feel, and I couldn't feel, your aorta didn't seem to have any pain or tenderness in it. Okay, I am going to feel down here for your popliteal. There we go. posterior tibialis. Here. And your dorsal. Excellent. And you said you haven't noticed any swelling, any edema in your legs. I noticed that you have even hair distribution, that there's no discoloration in the skin when I come down. Okay, great. They're even +2 throughout. Next thing I would like to do, please, is to test the range of motion of your lower body for me, please, okay? I'm going to ask you to raise your leg all the way up for me, please. Your right leg up. All right, and then come back down and bend your knee and bring it to you, please. Fantastic, and come back down. Bring it out. I'm sorry, thank you. And then cross your body. Okay, good. Is any pain or tenderness in your hip or anything?
No.
I'm going to ask you to do this leg for me the same way. Bring it all the way up. All right, and down. Knee to chest. And down. All the way outside. And then all the way back across. All right, great. Thank you. All right. Try and raise your leg for me, please. Okay, and down. And then press down. Good. Did you have any tenderness in this area when I pressed on your leg down like that?
No.
Do you still have your appendix?
Yes.
Have you ever had any tenderness or any problems, any rebound pain, anything there?
No.
Okay, so if I do this like that, that doesn't bother you.
Do it again? Ah. No.
That's not
no.
too bad. I would need to send you to the hospital if that's what you were going to do, because we would need to have you evaluated. All right, if I could have you raise your leg up and push up against my hand, and then push down against my hand. Push in towards me, please, and then push away from me. Good. And let's do this side again. Push towards me, and then push away from me. Okay. Now I'm going to ask you to take your feet and flex them down, and up, and now turn your toes in, and then out. Good. All right. And if you'll just relax for me, please. I'm going to check on your reflexes. Okay, excellent. Okay. You're not ticklish, are you?
Not
No,
really.
not really. Okay, good. All right. You have any trouble with your feet, toes, ankles, anything like that?
No, I just need to cut my toenails.
Okay. Do you have trouble with your knees? Have you ever had any clicking when you go up and down the stairs? Does it ever feel like when you squat that something's getting caught? Anything like that?
No, I just
Okay.
almost destroyed my knee a couple of times.
And which knee did you almost destroy?
The right knee.
The right knee, which is the one I'm on. Okay, well, I'll be sure to be very careful. I'd like for you to relax your knee for me. I'm going to test your, see if you have a meniscus tear, okay? All right, I'm going to bend it up. Was there any tenderness? I didn't feel any clicking when I did that.
No tenderness.
Okay, excellent. I'm going to do this. Just relax for me, please, and bend your knee. Okay, and then felt a little bit clicking on that one.
Did you?
Yeah, just a small click right there. All right. I'm going to ask you to sit up for me. Oh, would you do one more favor and turn over onto your stomach for me, please?
Absolutely.
Okay. Okay. Okay, and now will you take this leg and raise it up for me, please? Okay, keep it straight when you do it. All right, great. Now push down and pull up. All right, and do this leg all the way up as high as you can get it. Okay, push down and pull up. Okay, good. Did you have any pain in your lower back when you did any of that?
No, I didn't.
Okay, you could roll over for me, please. All right, and then you can sit up if you would like. Bring your legs back around over here.
This exam table is hard.
I know. I'm sorry. Budget cuts with Obamacare and all.
Yeah.
Okay, I am going to ask you to press against my hands, great, and then pull your feet up for me. Excellent. Okay, straight bilateral. I am going to test your arms, take them straight out for me. Great. Bring one into your nose and then the other. Good. Put your hands above your head. Okay, down by your side. Okay, back behind your back. And then wash your hair. Okay, good. And if you could take your arms and flex them like this for me, please. Good. And pull against me and push against me. Excellent. And take your hands straight out. Flip them over. Good. Bring them back down. Drop your hands. Bring them all the way back up. Straighten them out. Open your fingers. Close your fingers. Make a fist. And open them back up. And then just drop your fingers to this point. This right here. Okay, thank you. Great. I would like you to squeeze my fingers at the same time. Squeeze. Good, thank you. Okay, now I'm also going to test you for some perception and for your cranial, your cognitive. Take you to finger to thumb like this on both hands, and then increase in speed. And more. Okay, great. All right, now just relax. That was perfect. Put your hands on your knees, and then I want you to take them and flip them over, and then back down. And continue to do that and increase in speed as you do it. Excellent. Okay. Now, I am going to ask you to do one thing for me, please. I'm going to see if you can feel the vibrations for me. I'm going to move your watch up just a smidgen. Can you feel that in your wrist? Okay.
Yes.
Okay. I'll check your ankles too. Is that good? Okay.
Yes.
All right. The other thing I'm going to do is I'm going to test you for carpal tunnel. Tell me if you have any tenderness or any tingling in your hand when I do like that.
No.
Okay, let's try over here. This is called a Tennel test. All right. Carpal tunnel. The other thing I want to do is, I know you haven't complained about any shoulder pain. Has it been bothering you any? Get this exam portion out of the way.
No.
Okay. I just need to hold your hand up like this, and I want you to press against my hand, please. Does that cause any pain or tenderness in your shoulder and your joint? Okay. I'm going to do the same thing over here, please. Okay, and then press against my hand. Excellent. Okay. Can I get you to stand? All right. I want you to take and bend to right and left. Good. And I want you to flex backwards. And flex forward for me, please. And when you go down, I am going to feel your spine. Thank you. Do you have any problems, any diagnosis with scoliosis as a child, any scoliosis in the family, anything like this?
No.
Okay. If I could get you to walk forward for me, please. And I want you to do heel to toe on the way back.
Okay.
Yes. Okay, Aldo, put your arms out. Try it again with your arms by your side.
Oh.
Okay, try it again. Excellent. Okay, come back. And then the last thing that we're going to do is I'm going to have you stand sideways. And I'm going to put my hands right here just to help balance. And I'd like for you to close your eyes and tell me if you feel any swaying or dizziness, anything like that.
No.
Okay, great. And if you can have a seat. Hold on just a minute. You ready? I'm going to see if I can push you over. Okay, great. Have a seat for me, please. Okay, a couple more things. I'm going to open, close your eyes, and if you could tell me what I'm doing in your hand, please. What is what I'm drawing in your hand?
A circle.
Excellent. Okay. Last thing I'm going to do is do your tendon reflexes, please. Okay, just relax. I'm going to hold on to your arm, okay? All right. Okay. Just relax. Excellent. Just relax your arm. I'm going to hold it here. Like this. And over here for me, please. Thank you. This right here. Okay. there any questions or concerns that you have? You okay? Is there
Yes.
anything else that we need to cover? Any other things that you need to discuss with me?
No, ma'am.
Okay.
I'm fine.